everyone, so our presentation is on the sleep disorders that include
insomnia and narcolepsy,
sleep apnea and somnambulism,
night terrors and nightmares.
Hope you enjoy!
Insomnia is a chronic problem in getting adequate sleep. Some of its causes include excessive anxiety and tension, emotional problems such as depression, health problems such as back pain, ulcers, and asthma, and the use of stimulants like coffee.
Symptoms include difficulty falling asleep, difficulty staying asleep, and persistent early morning awakening.
Some treatments you can use are sedative drugs such as benzodiazepine. It was designed to relieve anxiety and reduce nighttime awakenings and increase the total sleep that you get.
Problems with sedatives. They have a carryover effect that make people drowsy and sluggish and impair their functioning. They can also cause an overdose in combination with alcohol or opiate drugs, and with use then you develop tolerance to the drug. Sleep apnea involves frequent reflexive gasping for air that awakens a person and disrupts sleep.
Some victims are awakened hundreds of times a night.
A cause of sleep apnea is that a person stops breathing for a minimum of 10 seconds and is accompanied by loud snoring.
Some of the side effects include that it leads to insomnia since you have to keep waking up and cannot stay asleep.
Treatments include surgery or drug therapy. A mask-like device is worn during sleep with an air pump that keeps the airways open and flowing normally. Narcolepsy is a disease marked by sudden and irresistible onsets of sleep during normal waking periods. They go directly from wakefulness into REM sleep for 10 to 20 minutes.
It's a dangerous condition since some victims fall asleep while they are driving or operating machinery.
It is also seen in 0.05% of the population.
Some causes include heredity. Some people are genetically predisposed to the disease.
Treatments include stimulant drugs to keep them awake and avoid entering the REM sleep stage. Somnambulism, also known as sleepwalking, occurs when a person arises and wanders about while still remaining asleep.
It tends to occur in the first 2 hours of sleep, during the slow wave sleep, during sleep stages 3 and 4 with theta and delta waves.
Episodes may last from 15 seconds to 30 minutes.
A person who has somnambulism can awaken during their journey or return to bed without any memory of what happened.
Some of its causes are that it's unknown but is thought to be a form of genetic disposition.
It does not appear to be a manifestation of underlying emotional or psychological problems.
Contrary to myths, it is safe to gently wake the sleepwalker.
Night terrors and nightmares. Nightmares are anxiety-arousing dreams that lead to awakening from REM sleep.
After the episode, the individual is able to fall back asleep with difficulty.
There is a correlation between nightmare distress and depression with neuroticism.
10% of adults have nightmares, but they are mainly common among children.
Children have sporadic nightmares, but a persistent nightmare may reflect an emotional disturbance.
Treatment for night terrors and nightmares are unnecessary since most children outgrow it.
Causes include anxiety, other sleep disorders, eating just before going to bed, which raise the body's metabolism and brain activity.
Night terrors are abrupt awakenings from non-REM sleep stage 4, accompanied by autonomic arousal and feelings of intense panic.
They also produce accelerations of the heart rate.
They let out a piercing cry, sit up, and stare into space. They do not usually recall the entire dream, but usually a recurring image.
The difference between night terrors and nightmares is that after nightmares, the individual is able to fall back asleep. Night terrors may keep the individual up for hours.
Treatments are not necessary for night terrors because they are only temporary.